Welcome to Get Real Health. I'm your host, Dr. Chana Davis. This show cuts through the noise to give you science-based insights from real experts so that you can make smart, healthy choices. One person under the weather can lead to a local disease outbreak, which can lead to an epidemic, which, as we all know too well, can lead to a full-on global pandemic. The world is eagerly awaiting a vaccine that can bring relief from COVID-19. Well, most of us are. The topic of vaccines continues to be mired in controversy. The anti-vax movement is as active as ever and continues to cloud the conversation on vaccine effectiveness and safety. My guest today, Dr. Bonnie Maldonado, is Chief of Pediatric Infectious Diseases at Stanford University, where she's also a professor of both pediatrics and health research. She trained in infectious diseases at Stanford University and Johns Hopkins and in epidemiology at the US CDC. On top of her infectious disease work, she serves as Stanford School of Medicine's Senior Associate Dean of Faculty Development and Diversity. Today, we'll be chatting about the massive, yet often invisible benefits that vaccines have brought us, the dangerous consequences of the anti-vax movement, and the huge importance of using credible, science-based resources to make your choices. We have a lot to cover, so let's dig in. Dr. Bonnie Maldonado, thank you so much for taking the time to talk today about vaccines. It is such an important topic, and you have the perfect expertise to speak to this in great detail.
Thank you.
So I guess a natural starting point is, why do vaccines exist? What have they done for us already? And what might a vaccine-less world look like? And I think that's a lot of people's minds right now, of course.
Yeah, sure. So we know that 20 years ago, the global mortality rate in children was about 20 million children under the age of 5 died every single year. And then just to put that in context, there's about 130 million births a year. So that's quite a number of children that die before their 5th birthday. And today, the death rate in children under 5 is somewhere on the order of about 5 million deaths per year under 5. So still a large number of children, but it's a 3/4 reduction. And most of that has to do with vaccination. Obviously, there are other factors as well. But we know that even using the basic vaccines in the global setting, we are seeing 3 million deaths a year averted every single year, just from the current basic vaccines that we use, not even the exciting new vaccines that we have available that can't all be used in the developing world. In the US, we know that for every dollar spent on vaccines, and again, it's not a money proposition, but for every dollar spent on vaccines, we save over $30 in healthcare costs, not to mention costs around deaths and disability due to vaccine preventable diseases.
But why then is there resistance? So why is this not something that everyone embraces then, given this?
Well, I think there's maybe a lot of reasons, but I think one of the major reasons in public health, and you can see this playing out right now with the COVID pandemic, is that people don't trust science. They don't trust facts. I don't know if they trust their sources of facts. And the question really is also around not seeing something makes it not exist. So if you have eliminated 3/4 of the world's deaths from diseases that we would see every day, every week, and now they're not there, then they must be either gone and never to return, or people don't even know about them. And I have to say that in my career, since I graduated from medical school and trained and became a practicing physician and faculty member here at Stanford, I was seeing these diseases every single week. And they're gone now. And so for those younger physicians, for young families, for the public at large, who are younger than me, mostly now, they just don't see these diseases as being important because they don't see them at all. And it's kind of a ironic, vicious cycle. They're not seeing them because people are being vaccinated. We've only really eradicated one infectious disease in humans, one, and that's smallpox. And that was officially declared eradicated in 1979. It's the only human infectious disease that has been eradicated. And it was probably one of the most deadly. And one infectious disease eradicated in animals. We could eradicate polio in people in the next few years, we hope. But certainly most diseases cannot be eradicated. There are some guidelines around how you can eradicate a disease, and most diseases won't be eradicated, but they can be treated. They can be treated or they can be vaccinated against. And so, as long as we're vaccinating, we will not see these diseases, and people will just forget that there's any efforts going on at all.
Yeah. What are some of the ones that have the greatest risk of coming back if we discontinue vaccination? Or, I mean, I guess they would all have a risk, but what are some of the ones that, I mean, I know there are some stories where there's been a backing off in some places and then a resurgence. So what are some of the sort of lessons learned from backing off?
Well, I think all of them, as you said, could be risks for returning, but which ones could have the most impact? And the
Mm-hmm.
ones that have the most impact fall into generally, I would say, two categories. One would be those that are most infectious because they
Mm-hmm.
would come back faster and spread through populations faster.
Mm-hmm.
But some of those may not be as important as others. The other category would be diseases that may or may not be as infectious, but may cause serious complications. So, for example, I can give you an example of each one.
Mm-hmm.
You've heard about measles, for example,
Yes.
and we know that measles is probably one of the most, if not the most contagious infectious diseases in the world that we know
Mm-hmm.
of now.
Wow.
And it basically everybody who was born before vaccination was available essentially had disease. Now, did everybody die? No, not everybody died, but at the same time, we know that many people did die from measles, and many people had complications. And we now know, using sophisticated tests, measles infection actually alters our immune system in long-term ways. That is,
Mm-hmm.
wild type regular measles disease has been shown to eliminate immune cells, memory immune cells that are important for fighting other infectious diseases over time.
Mm-hmm.
And so we know that this disease has a lot of downstream negative effects. Now, let me give you a different example. There's a bacteria called Haemophilus influenza type B.
Mm-hmm.
Haemophilus influenza type B was probably not it was very, very common until in the mid to late 1980s, early 1990s, when a really effective vaccine came along and eliminated the circulation of that bacteria. Now, is it gone completely? Probably not, because it circulates still. We know we can't eradicate it because it can be circulating in different populations, but the vaccination has really slowed the spread of that virus, of that bacteria in children in particular, who have the most consequences from it. It's very rare to see any infections from Haemophilus influenza type B. Now, this bacteria it lives in the mouth and the nose and the throat, and it can be transmitted in clustered areas around households, in daycare centers and schools. And this disease causes, at the very worst, about 10 in the US, somewhere around 10,000 or more cases of severe meningitis every year. Now, you might argue that 10,000 of meningitis is not a huge number, but it is quite a consequential problem that we no longer really see in the
Right.
US and in other countries where this vaccine is used, which is almost everywhere. But it also caused skin infections, it caused pneumonia, it caused ear infections, it caused a lot of other problems. And why would
Mm-hmm.
you subject a child to those? And we virtually do not see this disease more. So those are the two kinds of different
Yeah.
characteristics of diseases that could come back.
That makes sense. So I wanted to talk a little bit about efficacy because one of the reasons that people might argue against vaccination is that it's imperfect efficacy. So can you give us a sense of the range of efficacy we see in vaccines and how that sort of influences? I guess I'm actually curious in broad terms about how decisions are made, which vaccines should be mandatory. So how does efficacy play into sort of a prescription for vaccines?
Well, they're all over the map, right? Every
Mm-hmm.
disease is different. It's an objection looking for a cause. Why should I give a vaccine that's not perfect or 100%? Well, how many things in this world that are 100% effective? How many?
Mm-hmm.
Probably none,
Mm-hmm.
I would venture to say. Except things like if I step into a car, I'm likely to get really hurt. Yeah, that's
Yeah.
pretty close to 100%, likelihood. But the point is that why would you use that argument at all? If I can save a child from, if I have 40% or a 50% or a 70% or 80, 90, 100, whatever the number, you pick the number. If I can gamble on giving my child a safe intervention that will
Mm-hmm.
keep them safe and healthy, why wouldn't I do that? Why would I
Mm-hmm.
not do that? So that
Mm-hmm.
argument, why would that, why, I don't understand. That argument
Yeah.
makes no sense to me.
I
The
hear what you're
argument
saying.
would make sense if you said, well, I have a 50% chance of having a benefit and a 50% chance of having
Yes.
a bad effect.
Yes.
Okay, that's different, but that is not the case with
Right.
vaccines.
Right. So that's exactly where I wanted
So
to head,
I
was
think,
into the safety, the real safety profile of
right,
vaccines.
right. But we need to make that argument right up front, make it clear that that is not the case.
Mm-hmm.
The only time where that might be the case, for example, is treatments for serious diseases like cancer and other diseases where we know the death rates are going to be very, very high without any intervention. And then I think people's risk tolerance is much higher. So, for example, if you
Mm-hmm.
told somebody that they had a fatal disease and if they didn't do anything, their death rate would be, 100%. I'm sure the vast majority of people would do something about that.
Mm-hmm.
But so it's all about risk tolerance.
Mm-hmm. Mm-hmm.
But I think people just don't see that. And again, this is about what I said earlier about risk. People just don't see that these diseases are a risk to them. And
Yeah.
maybe not today, but in a week or a month or a year, they would be a risk if everybody decided to stop vaccinating. So let me come back
Yeah.
to your a second question, which is about efficacy. And efficacy varies, it's all over the map. And it depends on the way the organism works. And we don't have time in this segment to go through every single vaccine and what the efficacy is. You can look those up. But basically, I will say that the Drug Administration looks at the data, the epidemiology of a disease, that is, how common is the disease, how
Mm-hmm.
likely is it to cause serious harm and illness,
Mm-hmm.
and how likely is the vaccine to prevent or mitigate that disease. And I would say, and, and then obviously safety is of prime concern, always a
Yeah.
prime concern. So if something is safe and it works reasonably well, the epidemiology of the disease. So, for example, with measles, if you uh, get vaccine, you have a 95% chance with one dose of being protected for life against measles. 95%. Now, of those 5% who don't have that, for the vaccine doesn't work, if you vaccinate them with a second dose, then that number goes up 50%. So now you've got about 98% of the population protected with two doses. So that means only 2% of people out of 100, the vaccine would not work. And
Mm-hmm.
that actually is enough if everyone was vaccinated to prevent outbreaks of measles.
Yeah.
So you can go to the other end of the spectrum where we see diseases like rotavirus, which is a vaccine for a diarrheal disease that used to be one of the most common causes of death in children around the world. Diarrhea killed over 1 million children every year in the developing world. And you might argue, well, we don't care about that here because children don't die from diarrhea in the US, but they get hospitalized for it. So this vaccine actually has very good efficacy, on the order of 60 to 80% protection against severe diarrheal
Hmm.
disease or hospitalizations.
Hmm.
And in the developing world, it doesn't work as well, but it's still better than 50%.
Mm-hmm.
Now, if you can prevent 1 million deaths a year or reduce them by 50%, would you do that?
Yeah.
And the question there is, one of my colleagues said, you can look at it as a glass half empty question or a glass half full.
Mm-hmm.
But what we like to say is, how big is the glass? So if you're preventing 500,000 deaths a year
Right.
instead of 750,000 deaths a year or more, why wouldn't you do that? So,
Mm-hmm.
so there are ranges, and mostly the ranges for the common diseases of childhood. The ranges at the very low end are about 60% for, say, the pertussis vaccine, all the way up to 95% plus for things like measles and Haemophilus, et cetera.
Mm-hmm. Yeah, certainly when you look through a public health lens, it's very hard to make an argument. I mean, I can't imagine an argument against them. You just can't. Um, but of course, the parents. Then this sort of comes to a discussion of just again risk tolerance and how we perceive risk and how we think about risk. So can you shed some light on this on the safety side of things and what the science actually says?
Yeah, absolutely. Before you can give a vaccine, before a vaccine is licensed, it has to be tested in the laboratory to make sure that the endpoints are being reached in the lab. That is, does the effect of the vaccine really make sense in the lab? Can you show that the vaccine prevents either infection or inactivates the organism or prevents the side of the toxicity of the disease? So, for example, with pertussis, the vaccine itself doesn't really kill the bacteria. It actually inactivates toxins that the bacteria elaborates. It's called
Ah.
Bordetella pertussis. It inactivates the toxins that cause all of the symptoms that can lead to death and prolonged hospitalization in children. Now,
Mm-hmm.
it's not a great vaccine in way because it only has about 67 to 70% efficacy. And that's because that bacteria elaborates lots of toxins, and there's not one mechanism that in which it works. So you have to attack it from many different ways, and it doesn't work perfectly, but it still has reduced pertussis to very good high level from very high levels to levels that are actually pretty low, and that really we need to keep surveillance for that, because if we don't continue to vaccinate, or in cases revaccinate certain populations, you wind up with a resurgence of disease. But that used to be a major cause of death for young babies and prolonged hospitalization. And the safety issue there is really, does this does this vaccine work in the tissue in the lab? Does it prevent disease? Does it prevent symptoms? Does it inactivate the organism? How does it work well and then if you do the preclinical studies and they look safe, then you apply these to healthy individuals, usually healthy adults, and you look for side effects. But the FDA will not approve a vaccine that is not highly safe in people.
Mm-hmm.
And by that I mean most vaccines do have side effects, and the vast majority, over 85% or 90% of side effects are uh, local pain at the site of injection, sometimes redness or swelling, and occasionally with some vaccines, there may be a low-grade fever associated with that vaccine for a short period of time.
Mm-hmm.
But the benefits are that you are now protected against a disease that can really be devastating. Everybody wants to do, we hope, mostly everybody wants to do what's right for their kids.
Yeah.
And everybody would like the data. People want to hear data. They want to know what friends think. They want to know what people who they think. And I think what we face sometimes, maybe I mentioned this earlier, not everybody trusts science anymore. And, I don't know what to say about that. If you don't trust science and facts, I don't know what else to say. I can give you science and facts and data because they are real. We don't make them up. But there are other people who trust other things in addition to facts and data, and that's trusted people in their communities, etc.
Mm-hmm.
What we do is we really try to work with community leaders who people do trust to help them work with their populations and say, look, here is what I think as a trusted community leader. This is what I'm convinced about. And it's really about having that two-way communication, having a dialogue. So I think that, some of us obviously train and do this for a living, but it doesn't mean that I should go out and just say, I think this is good for you, just do it. That's not the way we try to provide care. And pediatricians and people who take care of children don't do that in general. What we do is we try to say, here's a disease. Here is a way to prevent that disease. Here's a list of potential complications of the vaccine.
Mm-hmm.
Here's a list of all the known complications of this disease.
Mm-hmm.
Here's what all of our colleagues recommend. Here's what the people in the community recommend. Do you have questions? Most people will have questions, and that's what they should do. And
Mm-hmm.
then we answer those questions. And I have to say that the vast majority of the time, that's what it takes is good communication and trust.
Mm-hmm.
So I think that's really the way I would frame it rather than, well, because people will say, well, why should I do this? I get it. But they come in and then they ask their questions and then we discuss it. You have a dialogue and people will agree.
Mm-hmm.
Again, there's always a very, there's everything has a bell shape. There is going to be a small group of people who are just never going to be convinced. And I see that happening.
Mm-hmm.
And, there's not much we can do at
Yeah.
this point. We would like to be able to have more of a dialogue with that group of people, but some people just don't trust established institutions. They just don't.
Yeah. I mean, I guess I was going to say it's sort of, yeah, there's the one situation that where you have the patient in front of you and you're presenting them with the opportunity to make an informed decision. But there's others who are not even in a care context, right? Like say a COVID vaccine comes out and then people are deciding whether to get it or not. They're not having a discussion with an expert in front of them.
I don't think everyone needs to be sitting literally face to face with a
Mm-hmm.
expert. That's not the whole idea. I'm talking as a provider. Everybody should have some system of healthcare. I don't
Mm-hmm.
think that this society should exist without people, every single person in this country having access to a healthcare. And that's the person they should be engaging with.
That makes sense.
And
Yeah. Well,
public health should be engaging and messaging through media. There's lots of ways. I mean, in this day and age, to say that you don't have access to data, it just doesn't, we're just not accessing the right. If people don't have access to data, it's because we're not accessing their sources of communication, because everybody has access to data nowadays, just about.
yeah. What would you actually recommend if someone is watching this and says, "I want to go learn more and see some scientific data"? Where do you begin?
Well, there are some websites. American Academy of Pediatrics. It's a
Mm.
nonprofit, private organization. It's not driven by funding or it doesn't make money. It represents over 67,000 pediatricians around the country. It is the resource for pediatric information around the world. Most pediatric societies depend on the American Academy of Pediatrics for guidance or collaboration. So that website is aap.org, and you
Okay.
can find lots of information there. And the reason I don't bring up all the federal websites is because a lot of people don't trust the government for whatever reason. But
Mm-hmm.
the government actually is a really good source of data because whatever they put in their website is easily vetted and there are references. But people want to go to the federal website, it's cdc.gov,
Okay.
and you can look up any vaccine you want there, and any information about health is on the site. But aap.org, the American Academy of Pediatrics, has lots and lots of data on not just vaccines, but chronic diseases, teenage issues, school issues, vaping. They talk about every
Mm.
issue may affect children or adolescents. So I would at least start there, and then you can
Mm-hmm.
start looking for links for other websites as well.
We're almost out of time here. So, is there anything else you would want to add in concluding for those who are looking to make informed choices about vaccines? We
No, I
feel
mean,
like
I
we covered
think
a lot.
well, I will just summarize by saying that I think that parents are very well informed. They have access to lots of data, more than any other generation to date. And,
Mm-hmm.
and that data can be confusing because
Mm-hmm.
it may be, from a reliable source. It may not be from a reliable source. A lot of young parents nowadays rely on their friends, and that's great. But their friends they should also start to really look for data sources that are reliable. And in
Mm-hmm.
general, reliable data comes from independent, scientifically vetted sources, such as
Mm-hmm.
the two I mentioned, and there are
Mm-hmm.
many, many, many others.
Mm-hmm.
And so I do encourage people to talk to their healthcare providers. Every child should have a healthcare provider, every single one.
Mm-hmm. Mm-hmm.
And I would encourage every child to, as parents, to talk to their providers about this, not only immunizations, but all healthcare issues
Mm-hmm.
around their children. These are the people who really know what's they deal with this day in and day out. They know what to talk to families, and they are experts in how to take care of children. And I would hope that everybody has that access.
Yep.
And social media. If you feel like you want to get on social media, then you message out what you've heard from your provider as well.
That's great advice.
And the last thing is not to forget during COVID to really get children vaccinated, because we're seeing major outbreaks around the world of measles, diphtheria, which we haven't seen in many, many decades, and
Oh.
even cholera. And part of it has to do with either vaccination. People aren't going in for vaccinations. Infrastructure is not available in other countries. But in this country, we're seeing a dramatic decrease in immunizations, mostly because people are afraid to go back and be seen by their providers. And so we really encourage
Wow.
people to come back in and get their vaccines, because if school is going to start in the fall, that's
Yeah.
a good spot to start another outbreak. And we don't need more than
Yeah.
one. We need zero outbreaks.
Yeah. Okay. Well, thank you very much for your time, Dr.
Right.
Maldonado. This has been,
Yeah. Thank
um,
you.
yeah, it's been great to get things really straight from an expert and get some resources for people who want
Yeah.
to learn more.
Great. Well, it's
So
great
thanks
talking
again.
to you.
Yeah, I'll let
All
you
right.
get on
Take
to your next
care.
call. Okay. Take care.
Yeah. Thanks.